And the chair now recognizes Ms. Maureen Rosette for 5 minutes.
Good morning. My name is Maureen Rosette, and I'm a citizen of the Chippewa Cree tribe and also a board member of the National Council of Urban Indian Health, NCUIH. NCUIH is the national advocate to ensure urban Indian organizations have the resources and policy support to help serve the over 70% of American Indians and Alaska Natives living off reservation. I'm also the Chief Operating Officer at the Native Project, a UIO in Spokane, Washington, which has a service population of over 20,000 American Indians and Alaska Native people. In our facility alone, we have served Natives from over 300 different tribes. Let me start by thanking Chairwoman Hageman, Ranking Member Ledger Fernandez, and members of the subcommittee for inviting NCUIH to testify. I wanted to remind the committee of the importance of urban Indian organizations to the Indian health system. Growing up, I lived and grew up on my reservation, and I was a consumer of my own tribally operated health program at the age of 28. I moved to Spokane to go to law school. I had no health insurance. I had 2 little kids, a 3-year-old and a 5-year-old. We had no health insurance. At the time, if Native Project had medical services, we would have had some health care, at least access to health care, but we didn't at the time. I just hoped and prayed that none of us got sick. Now, I have insurance and I can go anywhere I want, but our family has chosen to be consumers of Native Project because of the excellent health care we get there, and it's culturally appropriate. That's what we want. So today there are 41 UIOs, which are a fundamental and necessary component of the Indian health system, and we work hand in hand with IHS to help provide the resources necessary to provide health care to Native people. As the committee knows, IHS has been on the GAO's high-risk report since 2017. Although IHS has been making progress on the GAO recommendations, full and stable funding has continuously been a barrier to addressing these recommendations. We are grateful that Congress finally passed advance appropriations for IHS in last year's omnibus. For over 50 years, without advance appropriations or mandatory funding, our providers have been operating without budget certainty. Indian health providers had to operate knowing they will not be able to pay their doctors on time because of late payments due to politics in Congress. This instability created barriers for our providers, and we could not be the hubs for innovative solutions for our communities. Advance appropriations will now allow IHS to make long-term cost-saving purchases and minimize the administrative burdens for the agency and UIOs. Advance appropriations will also improve accountability and increase staff recruitment and retention at IHS. When IHS distributes its funding on time, our UIOs can pay our doctors and providers. This means that Native people can have access to the care and services they need to be thriving communities. As such, we request the committee work with the appropriators to ensure advance appropriation is maintained in future years. Despite these historical challenges, urban Indian organizations have been great stewards of the funds we can access. Increases in funding have been met with improvements in the care we provide to our community. For example, my organization, the Native Project, has used our funding to build and create a new Children and Youth Services Center. We broke ground on this center in May of 22 and are looking forward to the increased care we will be able to provide our community. This new building will provide substance use and mental health resources such as therapy and wellness practices and provide space for traditional Indigenous practices. We will now have a space for healing our children as they grow to become the future of our communities. The Declaration of the National Indian Health Policy states, "It is the policy of this nation in fulfillment of its special trust responsibilities and legal obligations to Indians to ensure the highest possible health status for Indians and urban Indians to provide all resources necessary to effect that policy. The Indian health service system is essential to fulfilling this policy." As IHS works to address the key issues and recommendations provided by the GAO, they must not be hindered by lack of funding stability, and budgetary cuts. Full funding will ensure IHS operates to provide the best health care possible for our people. We urge Congress to take this obligation seriously and work with IHS to ensure they have the resources necessary to protect Native lives. Thank you.